As we have all seen in recent weeks, the newest variant, the Omicron variant of concern, is adding new and more complex challenges to our pandemic, and we are no exception here in British Columbia. Omicron is rapidly replacing the other variants here in BC, primarily Delta. There's several different strains of Delta that have been causing infections around our province, and as we have noted, has rapidly started causing rapid increase in the number of new cases of COVID-19 that we're seeing, particularly in Vancouver Coastal and the Fraser Health Region and here on Vancouver Island. It is moving quickly, and so must we. This is, of course, not where we want to be. We were making good progress. We had turned the corner of the wave that we've been dealing with for the last few months here in BC, but it is the reality of where we are. And right now, we need to slow the spread and ensure that our healthcare system and our communities are protected. We will see more cases. We know now globally that this Omicron strain is replacing Delta around the world. It is more transmissible, which means that it can spread with even a smaller amount of virus. It is spreading more rapidly than before, and we need to flatten that curve. If we see rapid increases in cases, we know that a certain proportion of those people will need hospital care. Right now, most of the cases that we're seeing are in younger people that are more connected, so it's spreading very rapidly, but they're not having severe illness. It's mostly mild illness, and that is for a couple of reasons. One, because people are younger right now, and also because we have very high vaccination rates, and that is reflected in the people who are getting infected right now, where we have not had hospitalizations and people in the community who've had Omicron that we're aware of yet. But we know that we see the trajectory in countries around the world, and we're not going to be an exception to that. We will see rapidly rising cases over the next few weeks, and we need to take additional measures to slow that down so that we don't overwhelm our hospital system. One of the things that we also know is that if you are not yet vaccinated, if you do not have that protection that vaccination gives, this virus is spreading and more people are infected. You are at risk. Now is the time to get vaccinated. This virus will find you. We need to get vaccinated as soon as possible. Without a vaccine, you are at higher risk of serious illness and hospitalization. We know now with this strain that even if you are fully vaccinated, you can get infected, but it is a milder illness for most of those people.